nursing students, we are all aware of our nursing scope of practice. It's pretty much the things that you're allowed to do at each year level that you're at. So there's certain things that you can do in your second year that you can't do in your first year, and things that you can do in your third year that you can't do in your second year, and that sort of thing. Well, today I'm not going to be focusing on your scope of practice, but I'm just going to be focusing on general things that you as a nursing student and as a future nurse, you should never or avoid doing as much as possible. The very first thing is lying. It has come to a point where, a lot of lying and deception is just become the norm in nursing, and there's different ways that people lie that sometimes you might think it's for the good of the patient or for the career, but might actually end up being very detrimental to the patient's health. The very first example would be giving false hope to patients or their families, like telling them, no, don't worry, your family member or your sister is going to be just fine, but you very well know that the patient is not going to survive the night. Or telling a patient, nah, this will not hurt a lot, but this is gonna hurt, because we all have different pain thresholds. So you telling them it might not hurt a lot is technically lying to them, because you don't know how much pain they can handle. Another common one is making false entries where a certain thing was done too early. A big example with this is medications, where medication is given either too early or too late, but people signed for the correct time that it was given, or during the late hours, especially in our hospital setting, when entry is done at 4 o'clock but the right was done at 5. Those type of things, they all consist of lying. And sometimes we do it because we think, it's just too much admin. Or sometimes we even lie to patients that we can't do a certain procedure because it's too inconvenient for us. But please avoid doing these things, because it's really bad habits that you're going to be creating for yourself, and you never know who you might be lying to. Sometimes you might even lie to a doctor, to another nurse, or even someone who works in the healthcare system, and they know how things are, and they will actually catch you up on that, and it will just break the trust that you have with your patients, and no one would really trust you, because you don't want to work with someone who's going to lie about your condition or about the service that they're going to give you, because you never know, they might be giving you wrong medication and lie to you that it's the right medication. I know we are all studying hard, and we know our stuff, we know our patients, we know our medication, but there's a time and a place to review all that. Please do not be a know-it-all. Know-it-alls are the most annoying people to teach, because they're less likely to want to learn the right thing or the correct way of doing something, because they think they know everything. And this mostly happens to those that had a previous career, whether they were a paramedic or a carer somewhere, now they're studying to be a registered nurse, or they've had some sort of experience, whether they're family members or doctors or nurses and that sort of thing. They are irritating and very, very difficult to train and teach and get them to lose certain traits that they have because they think they know it all. Please do not be that person, because you are in the facility to learn, and yes, you might know everything theoretically, but you might not know things practically. And there's a lot of people that have had lots of experience in the hospital setting, and if you come out as a person who is not willing to learn because you think you know everything, they are less likely to teach you, and it's going to come out as they're being rude to you and that sort of thing. But it's very difficult to teach you if you're a person who does not want to be taught. And even if your senior or the sister in the hospital is teaching you something that it's fine, let her explain, and maybe you can get better clarification or better examples, a better understanding of that certain thing, even if you know the basic knowledge of it. And then I have had a question from one of my viewers, and they were asking, does nursing get less manual labor or less bedside manner and that sort of thing? And yes, the higher you go in nursing, the less manual stuff that you're doing, because obviously you have higher responsibilities and that sort of thing. But please don't make it make you arrogant and think because you're in your third year you all of a sudden can't do nurse stuff that you were doing in first year. All of a sudden can't be washing patients and that sort of thing. Even when you're a registered nurse or a matron and that sort of thing, nothing will ever be beneath you to be able to do it. Even if it's taking a kimby from a patient or giving a patient a bottle to pee in, you are there to help your patients and to make them comfortable, and you've gone through all the stages of it. You should continue practicing those bedside manners. Don't let a learning opportunity pass you by because either you are scared, you feel you're not ready to do it, or you're uncomfortable with, because that learning opportunity might be the last time you see it and you never see it again, because either you're moving facilities or that diagnosis is never going to happen again while you're around that facility. So even if you feel scared or you're not ready and that sort of thing, there's always going to be someone who is there to supervise you and who's more than willing to teach you how to do the thing. If you've never done a procedure or you've never done anything, let them know, look, I would love to learn, but I've never done this before, so just guide me through it. People are more than willing to teach people that are upfront about the things that they know and they don't know, instead of you going there and pretending. So if a sister tells you, there's this procedure that's going to happen, do you want to go watch it? Go ahead, even if it's on the opposite side of the hospital, if it's in a different ward, or if it's in a ward that's not even related to what you're doing. Don't lose those opportunities, because I feel sometimes we are so focused on the things that are happening in our own wards that we actually forget that there's other departments in the hospital. So if a patient is going for a CT scan, go with them so you can see how that part of the department works, because I've learned a lot of things that I need to prepare my patients for before they go for CT scans. For example, they need to make sure that all their jewelry are off, even their dentures and that sort of thing, before they go for their procedures. When patients are going for endoscopies or gastroscopies, there's a lot of things that you need to prepare your patient for. So as a result, if you go watch them do the procedure, you can better understand how the whole process works, and you can better give patient education to your patients, because they are going to ask you, how does this thing work? So if you have been there, you'll be able to educate your patients about it. This one is a pet peeve for me. Like I find it so annoying. One, talking about a patient's condition or their treatment plans to someone who doesn't directly treat that patient. Even if they're working in the same hospital or the same clinic, if they don't directly treat that patient, avoid talking to them about the patient. In addition to not sharing information about our patients, please also take note that this involves the notes that we write down about our patients, because I know in most wards, especially in a hospital, you have a list of the patients, their diagnosis, and the treatment plans that they're going to be receiving. Please make sure that does not just lie anywhere, because anyone can walk into the hospital or in the ward and see the information that they need about that patient, and could actually put the patient in danger. So please make sure that piece of paper stays with you, and once your shift is done, please rip it apart and destroy it, because if you take it home, you might leave it on a coffee counter somewhere and someone sees it and they do whatever they want to do with that information. So please be very aware of that. The thing is talking badly about your colleagues with your patients, and this mostly happens if it's someone that you speak the same language with, or you've got a connection of some sort, and they have got an issue with one of your colleagues, and they start bad mouthing with you, or just something happens around that patient and you guys start discussing about it and that sort of thing. Please just avoid gossiping in all aspects of it, because one, you never know who is listening, and you can actually get yourself reported for that, because you're giving that person information that they do not need to know. And also, if you're going to be bad mouthing your colleagues with your patient, they're less likely going to trust that colleague of yours because of the things that you have said. And please avoid it during tea time. Like, avoid it as much as possible. If your colleagues want to get into it, rather excuse yourself and go sit somewhere else. Just say, I really don't want to get into this conversation with you guys. Please do not gossip about your patients or your colleagues. It's just bad manners and damn rude. The very last thing is, please do not get into an argument in general, but especially in front of your patient, because things that are said in a heated conversation, it's very difficult to take them back, because sometimes you might reveal certain information about patients, about that person in general, about the both of you during that argument, and the people around you, once they've heard it, you can't take it back. You can't make them unlearn it or unlisten to it. So please just be mindful in how you handle conflict. If you don't like the way your supervisor spoke to you, or the way your doctor spoke to you in front of a patient and that sort of thing, just take them aside and say, look, I did not appreciate the way you phrased this and that sort of thing, and find a way to resolve it. Yes, we are not going to be best friends with everyone that we work with, but there's definitely a proper manner in which we can handle conflict to just provide the best care for our patients without, causing drama and being all passive aggressive about treatment because, you hate one another and that sort of thing. So just avoid those bedside manners. So if any of these things resonated with you, or you are doing any of them, please just type down in the comment below and say, I repent, and please do not do any of these things. So thank you guys so much for watching this video, and definitely share it with anyone else who might find this video useful. And if you enjoy this type of videos and would like to see more, definitely consider subscribing and joining the family. And you can join me again next week, Friday at 12 p.m. South African time, for a brand new video, or you can just click over here and over here to join me in another video. See you then. Bye.